I would like to start the history taking.
Can I start, Dr. Hussam?
Sure, but can I just would like to hear your name, your Dr. Arij? Are you the, can you use, yes, Dr. Arij, you want to start?
Yes.
Okay. I will add you.
Yes, if you don't mind, Dr. Hussam. Yeah.
How are you, Dr. Arij?
Yes.
So is it the first time for you to do a station? Have you been to the CASC before?
Yeah, this is the first time to present, yeah, here.
But have you been in the CASC before?
I did, yeah.
Okay,
Last May.
Okay, so what is your station, Dr. Arij?
Panic disorder.
Well, this is one of the difficult stations.
Mm-hmm.
Yeah, I will put it on the I hope that you all see the slide. So you have 2 minutes. You are supposed to have prepared the station, so we will not spend more than 2 minutes in preparing or arranging your thoughts before you start, okay? You have only 2 minutes, doctor, before we start. Or let's start when it reaches 3 p.m. GMT.
Okay.
I'm ready whenever you're ready.
Yeah, I am ready, Dr. Hussam.
Okay, I'll set the timer at 6 minutes. Hi, doctors. I hope that you mute your mics. Please mute your mics. Let Dr. Arij only be the one who's available for the talking. Okay? Hope that you all mute your mics, please. Okay, let's say that my name is Robin, and you'll be the doctor who will assist you. One, two, three. You can start.
Hello, hi, Mr. Robin. I am Dr. Arij. I'm one of the doctor working in the mental health team.
Hello.
Hi, how are you? Your heart doctor asked me to see you, Mr. Robin, as you've been experiencing some difficulties recently. Is that okay? If it's okay to have a chat with me?
I don't want to be rude, but I don't know why myself talking to a psychiatrist. I think I need a cardiologist, doctor. I have a problem in my heart.
Yeah, Mr. Robin, I understand that it's, you have, those difficulties, but, the mind, your mind and your body is very much connected. And sometimes if you have a psychological stressors or problems, that can be appears or manifested as a physical symptoms. Does that make sense?
Yes, yes, no problem. Okay.
Okay, okay. So do you, I would like to ask you a few questions, just to get a better understanding what's about what's happening,
Okay.
Yeah. So when all this started, Mr. Robin?
Well, it started about 6 months ago.
6 months ago. Okay, okay. And at that time, are you are you able to identify any problems or anything happened to you before
No,
your symptoms?
they come suddenly, and I just I don't know why they come, but they come. I
Okay,
don't know what happened.
okay. Yeah. And when you say is that happens suddenly, did you notice any change in the pattern or
Yeah, yeah, it is increasing with time.
oh,
And
okay.
I think it's on daily basis I'm getting these attacks.
Okay, okay. So it's becoming every daily almost.
Yes, yes.
Okay. And did you notice any increase in intensity? It became more intense.
No, it is the
The
same
same,
symptoms, but more frequent.
more frequent. Okay, okay. And there is you said there is no major trauma or nothing happened before that.
No, nothing, doctor. But I'm worried because I have an uncle who passed away because of a heart problem. I think it's
Okay,
running in our family, so
yeah.
I feel that I need to do more investigations. But they always say to me that you don't have any heart problems. I don't know what's going on.
Yeah, which is a good thing, Mr. Robin, that all your investigation and all, the images, what's the doctor done so far, it's all, good and it's all good sign. Um, so do you mind if I continue? I just, I have to ask more questions. You
Okay,
have,
no problem, no
okay,
problem.
okay. Yeah. Can you describe your symptoms when it happened to you? What's what you experience exactly?
Well, I have this heart racing feeling. I feel that my heart is racing, and I feel that I'm about to die, and I don't know where to get help except going to the emergency room. And
Okay.
it keeps going on, so maybe 3 or 4 times a week now.
Okay, okay. Must be very stressful.
Yes, yes, and I have shortness of breath, chest pain, all the heart problems, heart symptoms, but they say that there's nothing. I don't know what's going on, though.
Okay, okay. And how long it will take when it comes?
Around 15 minutes, 20 minutes.
Okay, not more than that. Okay.
Yes,
And
yes.
is it any particular situation or it can happen regardless in home, outside,
No, no, it just comes anywhere at any time.
anywhere
Okay.
and okay, okay. And apart, you said that you have, mostly you feel that there is a chest pain and you feel that, increase in your heart rate. Anything else happening? And the dry mouth, anything else, experience in your body?
Like what?
Do you feel that you have excessive sweating or your
Yes,
body
yes,
shaking?
yes, yes, yes,
Okay, okay, okay. And body shakes as well.
yes, exactly.
Okay, okay. And you as well, earlier, and thank you as well for sharing this. You said that you feel you have, a fear that you're gonna die.
Yes, yes,
Okay,
yes, yes.
okay, okay. And what you do when you have this, how you react to this
I
symptom?
just go and seek help from the nearest emergency department, and they always say that you don't have anything.
Okay. And between the attacks, how you feel in yourself?
Well, I keep. Now I'm very worried that I'm getting the attack again between
Mhm.
the attacks. Though I don't have anything, but I'm always worried.
You worried. Okay. Yeah. And this worries or you feel anxious during the episodes? Do you feel excessively worried?
Yes, 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 exactly.
Okay. 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 And you said you know the way that you go for emergency department, and do you get easily reassured when the doctors say there is no problem?
Temporarily, just but then I keep worried. I don't know. I feel
Okay,
that they have missed something.
okay. And I just as well, do you do you have any history of any does
1 minute
that the patient
remaining.
did you see a psychiatrist in the past?
No, no, this
No,
is first
no.
time to do psychiatry.
How is your mood being, Mr. Robin?
My mood is good, but I'm always worried, doctor.
Okay. And you how you keep, I mean, how you cope with this, because it must be very stressful.
I
Do
don't know
you
what to do. I really I don't know what to do.
do you drink alcohol or taking any
No,
drugs to reduce
no,
your
no,
symptoms? No, no. Okay. And sometimes people, when they feel quite in a huge stress, sometimes they experience abnormal things happening and they're seeing things that other people can't see.
no,
Or, no.
no, no.
Okay, okay. Did you ever have thoughts of
Fine,
harming
fine,
yourself?
fine, fine, fine. So how do you feel about what you did? Give me a
Time,
feedback.
time,
What?
the time. Time is a problem.
Yes,
Time.
yes, the time, and I'll give you nice advice about the time. So give her some feedback in our chat. Nobody is giving you feedback. What's
Yeah.
going on? But let's
Not
help her. Give her
not
some
every
feedback. They are all clever psychiatrists. So the first thing you know that you should show some empathy. Um,
Mhm.
I was trying to show to you that I am very worried, but you never once gave me some sort of reassurance. I can see that you are so worried. I rest assured that I will do my best to help you. And in the beginning, if you have noticed in my notes, there is a schedule of some sentences which will help you to be more empathetic. Very important to show empathy. It's not just to show that you know how to do history and elicit the symptoms. You must show that you also have this consultation skills, which will help you to pass the exam. The psychiatrist, why is he seeing a psychiatrist in the beginning? It was good, but it needs more just elaboration. Okay.
Mhm.
Other than this, it was very good. And the only thing that you need to know is that you should pay attention to the task. You should show that you know that there could be some predisposing factors. We know that there
Yes.
are, they focus now on the predisposing, precipitating, perpetuating factors.
Mhm.
So if we look at the task says here, and I hope that you all pay attention to this because sometimes the candidates do not pay attention to these things, that you should elicit the relevant etiological factors. So
Mhm.
what could be the etiological factors if there is a family history of similar problem, if this man has a history of or has symptoms of generalized anxiety disorder? Okay, so and as you can see here in the candidates and the role player notes, they instruct him that you appear to be anxious. He is instructed to be a person that to say that he has some sort of generalized anxiety disorder in before. Okay,
Mhm.
so pay attention to this. Regarding the time, you have a good construct. You are very organized, but the problem is that when you your sentences are not fluent, and when you calculate the amount of time wasted because you are interrupted, so you are talking in an interrupted way. So if you waste about 1 to 2 seconds in every sentence,
Mhm.
and you're going to say maybe 40 sentences in the session, in the station, so
Mhm.
you are wasting not less than 1 minute because of these pauses in every sentence. Okay, so pay attention to this. So let's see how to do this station. Let's see the feedback of our colleagues. Uh, sorry, I think it was nice, but some questions were repeated. Yes, this is lost of time because good attempt. Lengthy questions again, so you must prepare the right sentences, okay? So let's see how we can do. So as you can see, this is our plan, how to take about taking history. I hope that you all see it. You should start by taking the complaint, then the symptoms of the syndrome, the comorbidity, the impact, coping and risk, family history, and then finally the living the diagnosis. So these are the points which you should focus on, and this is your plan when you have a history task. When you see a history task, immediately write down in your notes these 6 points which will help you to cover the task program. And as you can see, there is a table here to remind all the candidates that you should be empathetic. I was trying to show that that I am very anxious and very worried. And actually, this is what you are going to get in the exam, that you will meet a patient who is very worried and anxious. So you should show empathy, okay? It will not be some sort of psychotherapy session, but at least use 1 to 2, maximum 3 sentences to show empathy. Okay, the first thing you should know is to do a good introduction, and the introduction is a very important point, and it has a simple rule. Simply introduce yourself, greet the patient, and explain why are you talking with the patient. Okay, for example, hello, Mr. X, I'm Dr. Ibrahim from the mental health unit. I've gathered from the notes that you have been referred by the cardiologist. I'm here to help you. Okay, this is simple. This is simple. And though it is very simple, yet some candidates struggle to do it. They either miss the name of the patient, they either miss saying who they are, or explain why they are talking with the patient. In this station, you will get the common question, why am I talking to a psychiatrist? And this is the standard answer. Okay, I understand where you come from. The mind and body is one unit. And many times the physical symptoms have psychological reasons, particularly when the physical assessments and investigations are free from any abnormalities. Are you happy to continue? Okay, so this is how you answer this question. Now, the most important point in the history taking task is how to take the complaint. And the complaint is simply, you want to know exactly what is the current situation, what is he suffering from, the symptoms which you did, and also which you have done. And then the onset course and duration, and then before the onset. This is how you take the complaint. So you want to know what are the current situation, what are the current complaint, what are the current symptoms, and then you want to know when did it start and if there has been any reason for any precipitating factors, okay? Anything happened at this time, and then the course, is it increasing, is it decreasing, what makes it increase, what makes it decrease. And then before the onset, it's very important to show that you know that nobody wakes up in the morning with a psychological problem. Definitely there could be some predisposing factors, okay, like some stressors. So this is very important to pick up the predisposing factors. This is how you take the complaint. And don't think that this is a waste of time. This will help you to tackle all the tricks of the Royal College, because most of the tricks of the Royal College is either before the onset or in the onset. So the candidates, the clever candidates for them, or the candidates who are able to pick up what happened before the onset to make the patient predisposed to this type of abnormality. Okay, then the symptoms of syndrome, many candidates struggle to gather the symptoms or cluster the symptoms of panic disorder. Any psychological phenomenon, you can understand it in a very good way, and you can cover it in depth if you just analyze it into thinking, feeling, physical symptoms, and behavior. So you want to know when the patient is suffering from this psychological phenomena. We did not yet decide whether it is panic disorder or not. You want to know exactly when he has this psychological phenomenon, what exactly are the thoughts which run in his mind, what are the feelings which he has, and the physical symptoms and his behavior. What does he do when he has these attacks, and in between the attacks, how is he doing, and does he feel worried about having another attacks? And exactly in this, because of very close to the behavior, you want to know if he has agoraphobia. Do you stay at home because of these worries? Okay, so if he has this particular symptoms, staying at home, this could be considered a complication of panic disorder, which is considered agoraphobia. Please.
ما أنا أكلت خلاص الحمد لله.
Okay. Now, regarding the second part of the task, which is the eliciting the etiological factors, you can do this task always in the comorbidity part, and you should signpost before you're asking the patient about anything in the comorbidity. You should signpost saying, I would like to check.
ನಾನು ಕಾರ್ನಾಗೆ ಕುಂತಿ ಸ್ಟೇಷನ್ ಮಾಡ್ತೀನಿ, ನಂದು ಮುಗಿಸ್ತೀನಿ.
Okay. Okay, so this is how you do it. Don't jump from the symptoms of panic disorder to suddenly ask him about his mood or if he has any other symptoms. Okay, now after assessing the patient, now we feel that it is more of an anxiety disorder. Check up for the anxiety symptoms like the phobias, generalized anxiety problems, and so on. Don't make your priority is the mood and hallucinations like what you did. It's obvious that it is an anxiety disorder. So you need to know more whether if he has generalized anxiety disorder or he has any phobias. Be clever in your assessment. Okay. Very important also in this station to check if he has any thyroid problems. It is very common to have thyroid problem, and this is one of the etiological factors. Okay. When you hear the bell of 6 minutes, whether you covered the comorbidity or no, you should have a very good time management. When you hear the bell of 6 minutes, immediately start covering the impact, coping, and risk. You can hardly cover the impact, coping, and risk, family history and past history, and deliver the diagnosis in 1 minute. So you should have a good time management plan. And your plan is when you hear the bell of 6 minutes, immediately start assessing the impact, coping, and risk. Then ask about the past history and family history. And this is also an important point because it's also related to the predisposing, the etiological factors. So if he has a family member, definitely this can be considered an etiological factor. And finally, deliver the diagnosis. Okay. Let's see the mark sheet. And it's all about the mark sheet, doctors, whether you use my notes or you use any source, it's all about this mark sheet. And this is the mark sheet in the hands of the examiner. When you know how you are going to assess and what the examiner is doing, definitely this will make you more confident and more calm and less anxious. The candidates go to the exam, they don't know how they are assessed, and this puts them on the edge because they don't know what is going on. Knowing how to be assessed definitely will help you to perform better in the task and definitely will help you to score better in POMS. So, does not identify issues and priorities you did, fails to recognize significance of aspects of history you did, cover the significant aspects of history and the important points of the history, does not listen to the presence or explore enough detail, no, you cover the symptoms in depth. Risk assessment, unfortunately, this is not enough. Did you ask me if I have any thoughts of self-harm?
Yes.
So, yeah, because panic disorder is associated with suicide.
Yes.
Does not pay sufficient attention to the patient's health view you did. Does not identify appropriate psychological or social information. So, as you can see, here, the social information, when you ask me about the stressors, anything, any social circumstances around the patient which can predispose this will help you to cover point number 6. Now, regarding the communication, everything is okay except that because you did not cover the task in 7 minutes, this can be considered that poor management of the consultation, and because your sentences could have been better. Point number 11 and 12 might be lost, okay? And this is not a pass or fail assessment, but just helping you to understand how to use this mark sheet. And always whenever just you want to do a station, please rapidly have a look at the material, which will help you to understand the subject. All what you need is to have just some educational images, to refresh your memory instead of going through textbooks. Never prepare for the task by the textbooks. Never ever. It will be a waste of time. Okay. I hope that you find it helpful, doctor. Okay. Thank you very much, mashallah. Okay.
Thank you.
Okay. Who would like to go next?
Can I go next, please?
Yes. Who are you, please? What is your name?
My name is Debbie.
Okay.
And my station was to be the somatoform pain disorder.
Okay. I'll put it right now on the somatoform pain.
Right, Dr. Sam.
Okay. Just I would like to share with you something before we start. As you can see, the role player here is instructed to show more about his symptoms if the psychiatrist is empathetic. And I think this instruction is with all the role players in all the station. If you don't show empathy, the role player will not be forthcoming and you will lose the station. Okay?
Yes.
Go.
Hello, I'm Dr. Okonji. I'm one of the psychiatrists in the unit. I
Hello.
understand you've been referred to me by your pain specialist.
Yes.
Okay,
But
so
I don't know why am I talking to a psychiatrist? I'm not crazy.
yes, I understand where you're coming from, and it might seem a little bit strange that you've been referred to psychiatrists, but it's quite common for people to be referred, especially as the mind and the body, they tend to work together. So sometimes something situations that we have in the mind can affect the body, and that's why I'm hoping that we can speak a bit more about your pain and see how
Okay.
we can address it and see ways that we
No
can
problem.
support.
No problem.
Okay. So could you tell me a little bit more about this back pain you've been having?
Well, it has been going on for about 2 years now. I visited multiple pain specialists and did multiple investigations, but all of them are normal so far. I don't know why the pain specialist has referred me, but maybe he will help me. Okay, so if you have any questions, I don't have any problem.
It does sound difficult to have had this pain for the past 3 years. Is there any specific part of your back where you're having this pain, or is it all over your back?
Well, it's this type of dull pain which is persistent, particularly in the lower part of the back. When
Okay.
it comes, I cannot just do anything. I must lay down, sleep, maybe for 1 to 2 hours, and then it goes away.
I'm sorry to hear about this pain. I wonder if there's anything that makes it better.
Well, nothing helps me to just to calm down and stay in a bed for about 2 hours without any stress, and then it will go away by itself, not doing nothing. That's it.
Okay. Does anything make it worse at all?
Well, nothing in particular. Just sometimes when I've gathered that sometimes with my wife, I get this back pain more at home. I feel that it is more at home. I don't know why. So
Mm.
I don't do a lot of activities at home actually.
Okay. Can we just look at sometimes when people are experiencing pain like this for a long time, sometimes it could be some stressors that can contribute to that pain. Have you been having any stress from home, or have there been what has been happening at home so
Well,
far?
I have some problems with issues with my wife. I have a problem that I'm not able to have babies, and we did a lot of investigations, and there's no hope, there's zero chance for me to have babies, but my wife insists that we must have a baby, and yeah, I don't know if this has any problem, any relation to it. She wants to adopt, so I'm not happy with this idea.
I'm sorry to hear this situation that you are having at home. It really sounds like there's quite a lot going on at home at the moment. I wonder if there have been any other stressors from work.
No.
Okay. Do you have any financial stress or anything like that?
No.
Okay. Apart from this back pain, do you have any other physical health concerns?
No.
Okay, so no other illnesses.
No.
I'd just like to ask if you have ever had to see a psychiatrist for anything before.
No, this is the first time.
Okay. I'd like to ask you a few questions just to see how you've been coping and how your mood has been.
Okay.
Could you tell me how your mood has been so far?
Well, I'm a bit frustrated because of the issues which I have at my house, and now this back pain. It seems that it's raining cats and dogs.
Hmm. And your energy levels?
Yes, it's good. If I don't have this back pain, it's good.
How is your sleep?
My sleep is good.
Okay. So you told me that it has been quite difficult with doing things around the house, you mentioned, and your energy levels as well. So would you say that this back pain has impacted your life?
Well, yes, definitely, because I did take many sick leaves, so far, too much sick leaves, and I
Okay.
think that they are not happy with that in my work.
Okay. Oh, I'm so quite sorry to hear that. Um, I just want to ask about if sorry, so you told me that you at the moment it has affected you with taking sick leave from work. Is that right?
Yes.
Okay. Okay. And I just want to know if
1 minute remaining.
I just want to know if there has been any thoughts to harm yourself at all because of this back pain.
No.
Okay. Sometimes when people have stressors like you're experiencing, they can sometimes experience the stress in their body as pain, just like you are experiencing. And I think it's likely that you might have a condition called somatoform pain disorder. Have you heard about that before?
No, no, what is this?
Okay, so it's when people are experiencing some mental stress, what is coming up in their body as pain. Would you be happy
Yes.
for us to look at ways we can discuss how we can help you in the future with this?
Okay.
Okay. So I'm happy for us to meet later on to discuss how we can support you with this. Is that okay with you?
Okay.
Thank you for speaking to me.
Okay. Thank you. How do you feel about what we did?
I feel like I covered quite a number of things. I think I got a bit of the history.
Okay, but you did not ask in particular how you did not assess the pain itself. So it was good, except that you must know how to assess the pain in order to come up with a real diagnosis that it is a psychological pain. You asked about everything related to the pain, but not the pain itself. So let's see how we can do this situation. Let's see the feedback of our colleagues. Give us some feedback and pay attention to the sound monotonous. I think because you're anxious. Yeah. So just please give the feedback after the candidates finish his performance. Okay. So. Okay. So you did not know my name until now. So this is the first important information. As I always say, pay attention to your introduction. Simply greet the patient by his name, introduce yourself, and explain why you are talking with him. Okay, and as you can see, though it is a very simple task, one of our clever colleagues did not do the simple introduction properly. She did not know the name of the patient until now. Even if the name is not given to you, which you should ask me, so how would you like me to address you? Maybe they will not give you a name, so you must ask the patient by his name. And what is his name? This is part of your job. It shows that you have good communication. Now, you did cover the complaint properly. You wanted to know exactly what he is suffering from, how the onset, the course, and the duration, and then what was happening before the onset. And it's very, very important. This is exactly what you did. And it will be also better if you ask him if he has ever had a persistent physical complaint despite having normal investigation, whether this has been the first time for him to have such type of pain. Okay. Now, this is how you assess a pain, and to come up with a diagnosis or a decision that it is a psychological pain. And this acronym, this is my acronym actually. You will not find it. So I have the copyrights. So it says penalized, okay, penalized. Okay, and these are the points which you should cover. The nature, you must ask him to describe the nature of the pain. Okay, is it dull aching or throbbing pain? Throbbing pain, usually it is an inflammation. Okay, location, what exactly is the location of the pain? Okay, does it progress anywhere? And is it associated with any other symptoms like tingling sensations in the lower limbs and so on? And effect, does it affect the bowel or urine control? So does it have any neurological symptoms? Okay. One of the most common and very professional questions to assess whether the pain is psychological or no is, does the pain wake him up from sleep? So if it is organic, It has nothing to do with the sleep, so it will be persistent during the sleep, and usually the patient will wake up from the sleep because of it. Whether it is, for example, we all had toothache before, or pain in one of our joints or bones, if there is a fracture or anything. So if the patient has an organic pain, no psychological pain, usually he will wake up from sleep because of it. The duration, how long does the pain last, and in between an investigation. So then you want to know exactly what, in between the attacks of pain, how is he doing? Is he worried to have any other attack? Does he spend time searching for a cause? Is it hypochondriasis? Okay, did you do investigations to know the reason? So you want to explore the hypochondriasis here. Do you feel that, when you know that the results are, do you feel reassured? Reassured. Okay. And finally, the explanation. So these 2 points in between an investigation explanation, you want to know if he has this pain. Okay. So these are the symptoms of the points which you should cover when you assess a pain, to come up with a diagnosis that it is a psychological pain, not a pain which is not organic. Okay. Now, comorbidity. Usually these types of psychological symptoms related to pain are usually associated with anxious personalities. So you start by assessing the comorbid anxiety disorders, okay? And then the depression, ask about the social. Physically, he has been referred to you. It's not very important to mention, because he has been referred to you after being physically cleared. So if you did not ask about the physical problems, no problem. Socially, you ask about more about which you did, the life circumstances, and so on. Now, how are you coping? Point number 5, as I said, whenever you hear the bell of 6 minutes, immediately start assessing the impact, coping, and risk. And in this particular station, you should ask about the use of excessive painkillers. Usually these patients consume painkillers because of this type of pain, and this can be something which can be hazardous, okay, because they are taking it for nothing. Okay. Well, how about your childhood and traumatic events? No problem if you forgot this, but if you have time, ask about the child. And finally, you deliver the diagnosis. It is one of the anxiety disorders in which the patient has pain due to psychological problem. And be ready, doctors, to have this simple explanation if you have time. Okay, this will give you a credit, an edge over the other candidates who just say the somatoform pain disorder. Simply, it is one of the anxiety disorders due to psychological problem. It makes the patient has pain due to psychological problem. I'll give you leaflets about it, and I'm looking forward to see you again. That's it. This is how you finish the station. And again, this type of the somatoform pain is a very common problem. If you have, I commonly find it in my practice. So you should just refresh your memory with some visual images about this type of pain. This will help you in your clinic. So let's see the worksheet. And again, this is to help you to understand how to use this worksheet. This should be your reference, whether you are practicing with your colleagues or with a tutor. Okay, don't let your subjective evaluation or the subjective evaluation of anyone else judge your performance. It's all down to this worksheet. Does not identify issues and priorities. You did identify the issue and the complaint and the main point to focus on. Fails to recognize significance of aspects of history. You did. Unfortunately, you did not elicit or explore enough the relative symptoms in the history. Does not demonstrate adequate skills risk assessment here, as I said, if he is coping with painkiller. This is very important in this type of station. So point number 3 and 4 will not be scored for you. Patient health view. Well, if you just cover this, the panelized, okay, how is he doing before the attacks and his explanation, point number 4, definitely point number 5 would be scored for you because you want to know his explanation and his perspective about this pain. Does not identify appropriate psychological information, point number 6 would be scored for you. Because you did not manage to cover the station in 7 minutes, so this can be considered as poor management of the consultation. Because you're anxious, this can be considered to be a formal approach. And because you missed my asking me my name, you didn't know my name. So I don't know where it can be put here, but I think this can be considered as poor questioning style, something like this. You didn't ask me about my name. It's never go out from a station without knowing your patient's name, okay? This is not a pass or fail, doctor. It's just to help you to understand how to do a station. It was a good performance. Just pay attention to the feedback of our colleagues and of course my feedback, and good luck, okay?
Thank you very much.
Thank you. Now, who would like to go next? I think we are.
I would like to go next, Dr.
Okay, so. Okay, Dr. Can you just tell me, Dr. Sneha.
Sneha.
Okay. Sneha. Doctor, how are you, doctor? Okay, so you are driving your car, so are you go? Will you be able?
No, I'm just sitting on.
Okay, so.
Yeah, I'll be able to do it because.
So what is your station, though? What is your station?
Specific phobia.
Okay.
Specific phobia.
Okay, you have 2 minutes. Just read your task, please.
Okay. 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 How can I address the patient?
You can call me Michael.
Michael. Okay. I'm ready.
Yeah, ready. Okay, that's very clever. Are you really sure you're ready? Okay.
Yeah.
Okay, so let's start. 1, 2, 3, go.
Hello, Mr. Michael. I'm Dr. Sneha. I'm one of the doctors working in the mental health unit. How are you doing today?
Well, I'm fine, doctor. I'm fine.
So, from the notes from the GP, I understand that you're having some problem with driving. Can we have a chat about that, Mr. Michael?
Yes, doctor. 3 months ago, I've not been able to drive, doctor. I don't know what's going on.
So, since when this is happening, Mr. Michael?
Since 3 months.
Since 3 months. Okay, did something happen before that?
Well, actually, yes. My car had struck a passenger side while I was driving, and the other car's brakes had failed, and I was not able to stop at the junction. And
Okay.
my car was damaged, but I was okay.
Okay, I understand that can be like very scary. So, will anyone else during this incident?
No. The other driver experienced some facial injuries, but you know, everything was okay.
Okay. So, Did you did you feel that your life was in danger during this accident, Mr.
Well,
Michael?
yes, for a moment, doctor, what accident happening? I felt that I was about to die, but
Mhm,
you know, everything was okay after that. But you know, I'm
mhm.
not able to drive since then.
Okay, okay. So, what happened after this? Like
Well,
after this incident happened?
after that, I'm not able to go to sit to drive, doctor. I can sit beside someone in the back seat in any car, but you know, driving or sitting in the front seats is very difficult.
Okay, okay. I understand, Mr. Michael. So, like, has this fear like increased from in the past 3 months, or is it the same?
Well, it's just the same, but it is affecting my life. You know, I'm not able to go to my work. It costs me a lot of money to use, you know, the transportation.
Okay, okay. That can be very distressful, Mr. Michael. I knew, like, I can understand that because of this fear, you're not able to go to your work, and it's significantly impacting your life. So, is it better if someone is there beside, like, you know, while driving to support you or something?
Well,
Is it better if someone is there along with you
just
while
say
driving?
if I'm sitting in the back seat, I'm okay. But if someone, I'm not happy to drive or
Mhm.
being in the front seat.
Okay. Mhm. So, does anything make it worse? Like, you know, when you're driving around, like the place where this accident happened,
Yes, whenever I'm
is it
just,
worse? Like when you're around the place?
yeah, I don't like to go there, doctor. You know,
Mhm.
I'm just, and I'm not happy to go to drive. That's it.
Okay, okay, Mr. Michael. So I understand that all this is happening since past 3 months. How were you doing before that?
Well, everything was okay. I didn't have any problem.
Okay. Okay, Mr. Michael. That's good to know that you were doing well before this accident happened. So, what exactly happens during this attacks? Like, what actually goes on in your mind?
When I'm in this in the driving seat, I just feel that I'm another accident will happen, and I feel that I'm not able to go
Mhm.
in to the streets. You know, I feel that I'm overwhelmed by the problem that I'm going to have a serious accident. So I just leave the car. I don't want to drive.
Mhm. So, do you experience any physical symptoms like, you know, racing of the heart, sweating, or
Yes,
something like that?
exactly. When I'm in the car, yeah, I have this. Yes, I feel trembling and I feel racing heart and sweaty. Okay.
Yes, yes, Mr. Michael, that can be very distressing. So, do you feel like something awful is going to happen or you're losing control?
Yeah, yes. I feel that definitely there will be an accident, another accident.
What do you do after this? Like,
I just leave this
when you're
driving
feeling the
seat.
symptoms?
I don't sit in the driver's seat or the front seat. I take a transportation method, a taxi, and that's it.
Mhm. Okay, okay, Mr. Michael, how are you doing between these episodes? Like,
Well, in between, I'm worried
are
that I will
you
have another,
okay
and
between these
you know,
episodes? Are you feeling
I'm
okay?
well. I'm very worried that I might have another accident. So this is what's really bothering me.
All right, Mr. Michael. Like, do you have any flashback about the incidents? Flashbacks or nightmares?
No. 1 minute remaining.
Okay, so otherwise worried about day-to-day activities.
Yeah, I'm a type of a worrying a person who gets easily worried. Yes.
With all this going on, Mr. Michael, how is your mood?
Well, mood is fine.
things are distressing. So some people try to cope with alcohol. Is that the thing with you?
No, no, no.
Okay. Okay. Do you get any suicidal thoughts because this time is like very distressing for you?
No, no, no.
Okay, Mr. Michael, after talking to you, I understand that you're going through something called a specific phobia. So we
Time.
can, I can
Good,
like,
good.
book
Time,
another
time,
appointment
time,
for us
time.
to
Very good.
discuss.
Time, time.
Okay.
It was very good, except that I feel that if you are in a better setting, you could have performed better. The first
Yeah, I was
point,
traveling, sorry.
yeah. So
Yeah.
pay attention that I'm giving you some information, but you don't pay attention to. So I told you in the beginning that it all started 3 months ago, and you repeated the question. Since when did it start? Pay attention to this. Show
Oh,
the
okay,
empathy
okay,
as soon
okay.
as possible. Show your empathy as soon as possible. So once I talk, that the next sentence after me talking should be a sentence of empathy. Don't postpone the empathy.
Okay.
So instead of suicidal
Sure.
thoughts, sometimes you just say it in a more palatable way. Sometimes stress can bring dark thoughts that life is not worth living or harming oneself. This will be better than suicidal thoughts. Okay. Before going through the slides, any feedback? I need to go next. Okay. Doctor, okay. If nobody.
I would like to go next.
Okay, so let's see the feed, the specific. Okay. Again, just remind you that this will be your plan. This is what you're going to write down in your note when you go to the exam. Once you see a history task, write down the points which you should cover: the complaint, the symptoms of the syndrome, comorbidity, impact, coping and risk, family history, past history, and finally delivering the diagnosis. Okay, this is your plan. And this is what you're going to do in 7 minutes. Good introduction. Your complaint was good. You wanted to know exactly what happened during the onset, and it is increasing. We took the complaint a very good way, and show empathy, please. Once you hear me talking, the next sentence immediately should be empathetic sentence, because I'm talking about a complaint. Okay, so onset course duration. Before the onset, you asked about it, so you took the complaint a very good way. So you want to know exactly whether it is a panic disorder or post-traumatic stress disorder. So ask me about the symptoms of panic disorder during the attacks, what runs in your mind. Do you feel that you are about to die? So again, thinking, feeling, and behavior. Okay, this is the main axes or main points which you should cover. And definitely this man has some sort of severe fear and anxiety during the stay while he's driving. That's why it is linked to driving, not nothing else. So it is considered to be a specific phobia. Okay, and you want to exclude if it is a post-traumatic stress disorder. You only ask me about the recall. Ask about the other items of the post-traumatic stress disorder, like emotional numbness, avoidance, and hypervigilance, and so on. Comorbidity, this is an anxiety disorder. Your priority here is to exclude the other comorbid anxiety disorder. Okay. Very important, check if this lady or this man has a thyroid problem. Very common. Any anxiety disorder is common with thyroid problems. Don't forget the social circumstances of the patient, because there is a point for the social circumstances. There's something which I think he did not ask me about my social life. Impact, coping, and risk. He asked about the risk. He did not ask about the past history and family history, but in the last second, you did deliver the diagnosis. And very important, the candidates who are able to reach the point of delivering the diagnosis have a better chance to pass. So let's see the mark sheet rapidly. Does not identify the issues and priority. You did identify the issues, and your priority is to assess the car accidents. Very good. Phase to recognize significance of aspects of history you picked up. The anxiety symptoms, and you focused on it, and you know the main points of history. Very good. The present. Well, here it is a question mark, and I don't like this situation because you should have excluded the post-traumatic stress disorder, and you should also make sure that these symptoms are only linked to. Did you ask me a question to show that these symptoms are only linked to the driving?
I did not do that.
So you don't know whether
I did
these
not ask.
symptoms.
Yes.
So you cannot come up with a specific phobia if you did not ask me this question.
Okay.
Does not demonstrate adequate skills in risk assessment. You did ask me. So does not pay sufficient attention to the patient's health. If you take assess the panic disorder in this way, when you ask about during what runs in his mind, what are his feelings, definitely this will cover point number 4. Point number 5 includes social information which you did not ask. So point number 5, 6, and point number 3 might not be good for you. Otherwise, regarding the communication, everything is okay. Everything is okay regarding the communication. This is not a pass or fail assessment, but just to help you understand that this is how you are assessed. And this mark sheet should be always your reference whenever you are practicing with anyone. Okay. I hope that you found it helpful. But by the way, very clever. Very clever.
Thank
Okay,
you.
so who would like to go next?
Can I go next if that's all right?
Can I go next?
Well, I don't know. We have 2 doctors who wants to just who would like to be the more.
Okay, fine. Let me take it. I will do next.
Who?
Sorry, it's just my children can come home at any moment, so I just want to do the station before they come back, if that's okay.
Okay, so
Okay,
I hope
fine.
that,
It's okay.
okay.
Yeah, it's okay. Let her take it.
Thank you.
Okay, so what is your station, doc?
It's conversion.
Conversions. Yeah. Okay.
Okay.
Yeah, ready? In this station, pay attention that you should show a lot of empathy. And you know that conversion is a reaction to stress, severe stress. So you should explore more about the stress. This is a very common mistake that the candidates just focus on they don't pay attention to the stress. We know that conversion is a reaction to severe stress. So you want to know more about the stress in her life, whether emotional, financial. You want to know more, maybe the stress in the work. Okay, all the types of stress which can be there. Okay.
Okay.
Okay. So let's start. 1, 2, 3, go.
Hello, Anna. My name is Dr. Abul Magda. I'm one of the psychiatrists working here. How are
Hello.
you? Hi.
Hello. Fine.
You okay? All right. Do you have any idea why we're having this conversation today?
Well, I don't know. Doctor been
All right.
asked to come to see doctors, and that's it.
Okay, okay. Yeah, so I had a look at your notes, and I can see you've been struggling with weakness in one of your legs. Is that right?
Yes.
Yeah, can you tell me a bit more about that?
Well, I've been in the funeral of my father, and suddenly I was not able to move all my left side,
Yeah.
and I fell on the ground, and they all took me immediately to the emergency room.
All right. I'm so sorry to hear about your father. When did that happen?
This happened today in the funeral.
Right, just today. Okay. All right. And you said that you felt weakness in your left leg, is that right?
All my left side, I'm not able to move my left
All of your
side.
left side. All right, okay. Right. And has any of the doctors talked to you about the investigations that you have done or the outcome of their discussions?
Well, they assessed me and they said that there's nothing. So who cares, though? So
Okay.
that's it. This is what I've been told. There is nothing, but I still am not able to move my left side.
All right. Okay. Let's see how we can help you, Anna. All right. Okay. Is it okay if I ask you a few extra questions? Is
No
that right?
problem.
Okay. Have you ever had any similar episodes in the past of weakness in any part of your body?
No.
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 And do you now have any other symptoms other than that weakness, like fainting,
No.
collapses, fits, anything like that?
No.
All right. Okay. So you said this just started today, am I right?
Yes.
Yeah. How were you before that?
Well, before that, I had a horrible time because my father has been in hospital for about 2 days because of car accident. I was the one who was driving, and I used to I drive fast. He kept saying to me, "Slow down." And we had an accident. He did not make it after that, and he passed away.
Right. I'm so sorry to hear that. Were you with him in the car?
I'm the one who was driving.
You were driving. All right. Okay. Sorry. Didn't catch that. Oh, it must be very difficult for you then. Yeah, I can see. It must be quite stressful for you to have this kind of experience.
Yes.
Yeah. So how has your mood been?
Well, since then I feel horrible. I
Yeah,
don't
I
know
can
what to
see.
do.
Yeah, and how's your appetite?
Well, I can't say that my appetite is good, but I don't want to eat. Who can think of eating now?
Okay, and you sleep?
Well, I sleep after crying too much. Keep crying all the past 2 days.
Okay, all right. Yeah, I'm very sorry to hear that. It must be quite difficult, Anna. Right. So other than what happened with you and your father, which is quite horrible, anything else that has been stressful for you recently?
Well, everyone is blaming me now. All of
Right.
them are blaming me for what happened.
Right. Okay. All right. And how are you coping with that?
I don't know what to do because, yes, I have to admit it's my mistake.
Okay. All right. These things do happen, Anna, and it's not your fault. We can probably think of something like counseling or something like that to help you with how you feel. Just a few extra questions, if that's okay. Have you seen a psychiatrist before in the past, or someone from a mental health? No. Or any family history of a mental health problem?
No,
Nothing like that. All right. So I'm just trying to get a whole picture really of what's been happening, because sometimes people respond to stress differently, and you seem to have responded to it in your own way, which is what we're seeing now, which is weakness in your left side. This is probably what we call a dissociative disorder or conversion disorder. Have you ever heard about that before?
No, what is this? What is this?
So it's simply having symptoms that could resemble nervous disorder or nervous system disorder, but it's actually because of stress. So the main cause of what you're going through is, we think, is stress. So as you said, the doctors have spoken to you already, and they've done some investigations, and they ruled out some of the differentials, and we think you're probably going through what we call dissociative disorder. Do you have any questions about the diagnosis or about what we've talked about?
Well, I don't care much. Who cares now? What is the diagnosis?
All right.
Who cares?
Okay. You seem to be quite low. I'm just a bit worried because people, when they go through these difficult times, think of things such as harming themselves or ending their lives. Have you thought of any of these before, or?
No.
Yeah, nothing like that. Okay, it's good to know. Right. I'm quite sure we can offer you things to help you with what you're going through. We can offer you, we can refer you to have some counseling because what you've been through is quite difficult. We can discuss it with our team as well to see what kind of therapy we can offer and if there are any medications that we can offer to help you. Is that all right?
Okay.
Do you have any questions?
1 minute remaining. No.
Okay. So probably I didn't prepare well for the station, but I just went with it. So probably forgot lots of questions.
Okay. So how do you feel about what you did? Give me your
Horrible. I feel like I've missed a lot of things. So I don't know. I can hear my heart beating now. Because
Have you ever been to the casting before?
No. It's the first time to do a station in front of lots of people, so I feel I'm panicking as well. So.
Okay, so you recommended that we go by the table. Actually, this is not the best thing to do because many of the candidates are not able to join in time. I just start by whoever is available.
Okay,
We start by asking the candidates to have a list. At least 4 candidates will say who would like to start. So at least a list of 4. Let's say this.
Okay.
Good communication skills. Okay, so let's see my feedback. So the first thing, do you have any idea why am I talking to you? This is not the best thing to start with. This is a very casual way of talking. So you explain to her that you want to say to her, so I would like to start by the good news that you have been assessed by the physicians and everything is okay. And I've been asked to talk with you. In this station, you will get the question, why am I talking to a psychiatrist? And you can say the routine answer that mind and body is one unit, and many times the physical symptoms can have psychological reasons behind them, etc. My condolences. I did not feel that I told you in this station you should be very empathetic. You were very formal, and use more empathetic sentences. I told you that I did not feel that you are paying attention to what I'm saying. I told you in the beginning that we have been in the funeral and I did not feel that. And then you asked me again what happened when it happened in the beginning. And I explained to you that I was driving and my father was beside me, and then he asked me, and where were you after that? So even you said that I did not get it. Your explanation
I think the volume as well. I didn't hear some of
my volume. Yes,
Yeah.
my volume. My voice is low, so I cannot fix my voice, but
Okay,
you can raise the voice of your computer. So I know that my voice is low, and it's very difficult to change it. So please raise the voice of your laptop.
Okay. All right.
When the task is management, is history taking, and you start talking about management, you should feel that you have messed up because you are out of the task. Okay, so okay, let's see the mark.
Sir, can I ask you, did you feel that I have lack of empathy, or
yeah, it was very well. If it's lack of empathy, if you are anxious, you cannot be empathetic. I felt that you're anxious. You are very anxious.
Okay.
You can never be empathetic while you're anxious. Okay.
Okay.
In this station, definitely you are going to be asked, why am I talking to psychiatrist? She have neurological symptoms, and now she's talking to psychiatrist. And this is the standard answer. Mind and body is one unit, etc. Okay. Now you start by taking the complaint. You want to know exactly what are the symptoms, and then ask about the onset. When did you start to feel that you're unable to move your left side? Did it happen suddenly or gradually? Any other symptoms happen at this time, like headache, dizziness, or blurring of vision? And then the cause, you feel that this weakness is increasing with time. So when you take the complaint, you find that it is just inability to move the left side. That's it. So there's nothing much will be taken from this complaint, except before the onset, which you have cleverly asked about. And this is the trick in the Royal College, because we know that conversion disorder, definitely there must be some sort of precipitating factors and so on. How was she doing before the onset? She has been through a tough time because her father was suffering because of the car accident, and eventually he passed away. Now, the symptoms of syndrome, you must establish that there is a disturbed mental state secondary to a severe stress and a set risk. So this is how you say that it is a conversion disorder. So there must be a severe stress, and then there is a disturbed mental state secondary to the stress. Okay, so stress can be different. Now you feel that it's all about this poor lady whose father has passed away, but you don't know she might have another familial problems. Now everyone is blaming her. For example, she might have been having some problems at her work and some financial problem. Everything is summed up, and eventually her mind couldn't tolerate this stress and converted it into physical symptoms. So we want to check if she has any other types of stressors. Can you tell me more about your recent stresses? When did this happen? Which about this this type of 1 minute. You'll ask about the car accident, okay? And very important to ask about positive changes happened around you after. This is considered the secondary gain, okay? Usually the conversion disorder has a primary gain, which is converting this the anxiety into physical symptoms, so the mind can rest from the anxiety. And there is secondary gain here, that the family started to stop blaming her, okay? And very important, doctor, I kept showing to you that I don't care. This is something, a sign called la balle in difference. Usually those who have conversion disorder, they don't show the appropriate psychological reaction. So they don't show that they are very stressed or anxious because of their symptoms. They just show a sort of indifference about their serious symptoms. Okay. Very important to ask the comorbidities. If she has, ask her about her mood, and ask her about the stresses, and then the impact, coping, and risk. Did you ask me about the risk?
Yeah, I said, did you have any thoughts of wanting to
Once
harm
you
yourself?
have the bell of 5 minutes, immediate 6 minutes, ask about impact, coping, and risk, past history, and family history. Now, usually those who have conversion disorder usually have traumatic childhood and some sort of abuse in their childhood, okay? If you ask this question, definitely this will reflect that you are clever, as well as chronic illnesses. So conversion disorder is common as chronic illnesses and traumatic childhood. And then termination. If you want to explain the conversion disorder Okay, just say this because I felt that your explanation was not that good. It is an overwhelming stress which the mind couldn't tolerate, so it converted it into physical symptoms, hence the name conversion disorder. And I'll give you leaflets about it. Okay, so let's see rapidly the mark sheet. You did identify the issues and priorities, the significance of aspects of history. You did know the important aspects. Okay, Dr. Aini, what is your question, Doctor?
Sorry, Dr. Hussam, to bother you here. Would you be kind enough to repeat how will we ask about label indifference?
Yeah, okay. How do you feel? So you put the question among the physical symptoms. How do you feel about not being able to move your left side, though there is no underlying disorder? Okay, do you wish to return back to normal? Okay, so she will show it to you label indifference. Okay, so that she doesn't care, she doesn't need, she's not very interested to return back to normal. She's not very frustrated. Okay, simple question. You can phrase it in many different ways. Okay.
Thank you so much.
Does not, so you did recognize the significance of aspects of history that she has this type of paralysis, and you started to ask about it. And your priority was to ask about the paralysis. Enough details in relevant symptoms. So unfortunately, no, because you did not ask about the second. Again, you did not dig more in her history, the other types of stresses which could be there, and the change in the circumstances around her, which can be perpetuating factors. Okay, you did ask me about the risk, so point 3 is not going to be scored for you. The patient health view, again, you did not ask me about how do we feel about it. The questions about of label indifference, which Dr. Aini just asked about. Social information here, if you were keen to ask about the social information, definitely this will help you also to score point number 3, because it's all about stresses in different aspects of her life. It was not very, we can say that it was organized, but because you did not show a lot of empathy, we can consider it as formalic, and your attitude was not that good. You should have been better, more empathetic. So point 8 and 9 might not be scored for you. Other than that, everything's okay. Again, it's not a pass or fail, but just to highlight the importance of the mark sheet. Very clever doctor. Is it your name is Dr. Atif? I don't know your name.
Dina.
Dr.
Yeah, my
Dina.
surname is Atif, but Dina. Yes.
Dr. Dina. Okay. Very clever. Okay.
Thank you. Thank you for your feedback.
Okay, who would like to go next?
Can I go next, sir?
Yeah, Dr. Suraya.
Surya Prabha.
Yeah, so how are you, doctor? So,
I'm good.
yeah, so what is your station?
Anorexia.
Yes, this is a very important one. Very difficult. Okay, so let's see. Don't forget the etiological factors, okay? So,
Okay, sir, we can start.
well, very clever. Okay.
So how may I address the patient?
Let's say that my name is Anna. Okay, let's
And okay.
give 1, 2, 3, go.
Hello, Miss Anna. I'm Dr. Surya Prabha, one of the psychiatrists with the mental health unit.
Hello.
I understand I understand your GP is quite concerned about your weight. Would you mind talking about it?
Yeah, no problem.
Yeah. So, can you tell me more about it? What was your average weight in past few months?
Well, I was on a diet, but it seemed that I lost too much weight, doctor.
Oh, okay. Is there any target weight or ideal weight you wanted to achieve?
Well, there is no particular weight, but I feel that I need just to lose weight. I feel I would look better if I lost more weight.
Oh, oh, okay. So, how did you manage to lose this weight?
Well, I just restrict eating and I go to the gym 2 times every day.
Oh, okay, okay. You said you have been on some strict diet, right? Can you walk me through a typical day of what you eat and how you follow it?
Well, I just start by practicing jogging in the morning, and then I just
Okay.
maybe take a biscuit, but not always. Sometimes I don't, and just go to the gym after that. I always calculate my calories when I go to lunch, and then I go to the gym again at night. And I don't
Oh,
have
okay.
supper. I don't take supper.
Oh, so I understand you have been skipping some meals in between. So was there ever a situation where you were starving?
Excuse me?
Uh, so I've noticed you have been skipping some meals. So was there ever a period you were starving?
Starving?
Like you weren't eating for a quite long time. You were hungry and you were not eating for a long time.
Yes, I just restrict food as much as possible. So I just maybe I do 20, 2 hours the window of eating and 22 hours of starving.
Oh, okay. Was there ever a situation where you lost control and had more than you intended to eat?
No, no.
Okay, okay. So, apart from diet and exercise, are there any other methods you have been following to lose weight?
What?
Apart from diet and exercise, were there any other ways you were following to lose weight?
Well,
Like
sometimes
some
I
laxative?
vomit. If I felt that I ate too much, I vomit.
Oh, okay. So, did you ever use some pills like laxatives or diuretics?
No.
Okay, thank you for sharing that. Uh, so, can you tell me more about how you look at your body, like how you feel about your body?
Well, I feel that if I lost weight, I will have a better shape.
Okay. So, is there any particular part of your body you're dissatisfied with?
No, just no, just all my body. I want to lose weight to all my body.
Yeah. So, you said you are feeling you're quite fat, and it would be good if you lose your weight. So, and did you share this view with anybody, your friends or family?
Did I what?
Did you share this view with anybody, like your friends or family?
No, no, no.
Okay. I gather from my notes that there are some physical health issues you have been facing. Can I ask about that? Can I ask you first about that more?
Okay, no problem.
So you have been missing your periods for past few months. Apart from that, do you have any other physical health issue?
Well, I fainted twice in the gym. That's why I went to the GP.
Okay. So was there any situation where you need to get hospitalized previously?
What?
Was there any situation where you need to get hospitalized previously?
No.
Oh, okay. So, would you like to tell me more about your family?
Okay, no problem.
So, who all stay with you? Who are a part of your family?
Well, I have two sisters and my mother and father. So we are all fine.
Okay. So, how is your relationship with your family members?
Well, not good. I don't feel that they always intervene. They don't give me the space of freedom which I need.
That must be a difficult situation for you. Uh, so, what do your family thinks about your idea of your eating habits and your feeling about how you appear?
Well, they were supporting me to lose weight, but eventually they felt that I need to talk to a doctor because I fainted.
Oh, okay, okay, that must be quite a tough time. Uh, so, how would your family describe you as a person?
Well, they all say that I'm perfectionistic. 1 minute remaining.
Okay, okay. So, have anybody ever commented on how you appear or about your weight in past?
Well, I always been bullied while I was a child because of this of my body weight.
Oh, that must be difficult. So, considering the situations happening lately, how has your mood been?
That was just fine.
Okay. So, did you ever have any ideas of harming yourself?
No.
Okay. So, how do you cope with the stress?
Whenever I'm stressed, I feel that I must, I go to jog and I go to the gym.
Okay. So, do you have a habit of taking alcohol or any recreational drugs?
No.
So, do anybody in your family have any eating disorder?
Fine. No. I don't know whether it is a communication or I don't know. We had a lot of interruptions. So give me your feedback about what you did.
I think here and there I jumbled up the order, and I didn't ask about the that organization like family history, and here and there I slightly mixed it up, I think.
Okay. So give her some feedback, Dr. Smith. Okay. So pay attention to the following, doctor. Whenever you talk about the weight and eating habits or the periods, I beg your pardon, you should always take the permission because these are sensitive issues. You don't go through them without taking permission, okay? I don't know why did you ask me about a particular part of your body. I did not have what was in your mind when you asked me about this question? If I had a problem.
Like any body image distortion and all, I wanted to ask, so I was asking that.
What?
Body image distortion, any body image distortion was also there. I wanted to ask, so I just asked.
Well, this can be put when you want to exclude the body mass, about the dysmorphobia. But you should at first check and cover the diagnostic criteria of anorexia. Again, I don't know why did you ask me ask me if any family member is sharing with you your view. What was in your mind when you asked this question?
So, like, I wanted to address, like, if there is any mismatch, only he perceives it as a distortion rather than the other people, and any impact on the family relation and dynamics because of this kind of situation.
Well, thank you, doctor. It seems that you are very clever, but the issue here in the task that they want you to show that you are able to take a constructed do a constructed approach in order to come up with a diagnosis. So you must know how to take history. Not only not talking with the patient about his problems to cover everything. They want you to know the main problem here. So it seems that you have a lot of things in your mind which you want to know. and you are just posing questions. Here you want to diagnose, come up finally with a particular diagnosis, and this should be your priority, okay? Well, what you are saying is important, but this is not your task here. You should come up with a diagnosis, and this question will not serve the diagnosis. Good cover of information, but no empathy. Yeah, not empathy. I think because she is talking fast because I think because you are anxious. Have you ever been to the class before? Have you been
No,
to the
never.
class? So yeah, you are
No.
anxious. So let's see how. Okay. Again, this is our plan. Do your introduction, take the complaint, cover the symptom syndrome, know the comorbidity, then impact, coping, and risk, know the past history, family history, and finally delivering the diagnosis. These are your 7 points. Okay. And again, pay attention that the weight and eating habits are sensitive issues, and you should approach talking about them sensitively. Okay. And it is not uncommon for the patients who are suffering from anorexia, please pay attention to this, to have bulimia. So clever candidates are those who are able also to elicit that this patient does not have bulimia. To have also an empathetic and highly intrusive, demanding family. So family issues are very important, and traumatic childhood. Okay. Okay, so let's see how we do this station. Introduce yourself. Okay, as I said, introduction is one of the consultation skills. Simply greet the patient, identify yourself, and explain why you are talking with the patient. And in this issue, you should show empathy because you know that weight and eating habits are sensitive issues. However, the GP feels that there has been excessive weight loss over the past year and needs to be medically evaluated. Therefore, I would like to discuss this sensitive issue with you. Are you okay with that? So this is how you approach this issue.
Okay.
Now, one question, doctor. Do you know my current weight? Did you ask me what is my current weight?
No, I didn't.
Suppose that my weight is 100 kilograms. Will you consider me an anorexic patient? So,
No.
so you want the first thing you want to know what is the current situation. Can you tell me what is your current situation and how much weight did you lose? Okay, so this lady maybe is for about 42 kilograms and she has lost in the past 6 months about 10 kilograms or 15 kilograms, which is too much for someone who is in this weight range of 65. Okay, you want to know exactly since when have you started intentionally losing weight? Anything happened at this time? Okay, so the story goes that she lost her boyfriend and she felt that if she has a better body shape, definitely this will help her to lose weight, to be better, okay? And you want to know the cause, so anything makes your desire to lose weight increase, like stresses, okay? And you will find that whenever she is stressed, she feels better. Whenever she feels that she lose weight, because this makes her feel that she is gaining control over herself and life. So you want to know what increased the weight loss, what makes this decrease, and during this period, have you ever had attacks of binge eating? So you want to know the cause, what increases, what decreases, and if she has any binge eating during this period. Okay. Okay. And before the onset, okay, you want to know exactly how was everything before the onset. So this is how we take the complaint. Okay, and before the onset, she has some issues with her boyfriend and it ended up by splitting, okay? Now, the symptoms of the syndrome, as I always say, whenever you want to understand any psychological phenomenon, you want to know exactly how the patient thinks, feels, and what is his behavior and what are the physical symptoms. So the thinking, what is your ideal body weight? The thoughts, what are the thoughts which are associated with this problem? What is your ideal body weight? How many kilograms you feel you should lose? Are you preoccupied with calories? So always her mind is busy with her body weight and kilograms and calories. And then feeling. How does she feel about her physical appearance? How do you feel when you eat too much? Does your weight make you less confident? So these are the associated feelings. She doesn't feel confident. She feels that her body physical appearance is not good. So, and then the most important thing is the apparent behavior. What do you do to lose weight? Is it okay for take me through your eating habits? Okay, how do you lose weight? Do you use purgatives or laxatives, etc.? And then the physical symptoms. Did you have any physical problems during your weight loss journey? She fainted twice. What about feeling weak or fainting? Can I ask sensitive clinical question? Are the periods regular? This is how you ask about the periods, doctor. Don't go through this sensitive issue suddenly, okay? Now, pay attention that the task is formed of two parts. The get a history to establish a diagnosis and assess the etiological factors. The part in which you are going to assess the etiological factors is in the assessing the comorbidity part, okay? So after assessing the symptoms of syndrome, signpost by a sentence which will show that you are now starting another area. Thank you for being open in this sensitive issue. However, I would like to know if there are any other associated problems or concerns. Then check her mood, okay? Check her social factors, and if there has been any other physical problems, okay? So this is how you assess the comorbidity. You put the assessment of the comorbidity. No, I mean, this is how you assess the etiological factors. You put the etiological factors with the point of comorbidities. When you feel the bell of 6 minutes, immediately ask about the impact, coping, and risk. Don't forget asking about the past history and family history, something which you did not ask about, by the way, because the story goes that she has a family member who also has been diagnosed with an eating disorder. And finally,
yeah, I asked at the end. Last minute I asked.
Okay.
Yeah, last minute.
This is my mistake. Okay, so this, well, I will go through the mark sheet, but for the last time, because just for the time issue. Again, this is not a pass or fail, but for you, Dr. Suraya, just to know exactly what is going to happen by the examiner while you are doing your station. So your priority here is to know what is her situation, what is her weight. So you did not do this. You want to know exactly why she has been referred to you by the GP. So you did not do this. So point number one, you're not going to have it. You don't know exactly. You didn't know why she has been referred. You didn't know what is her weight. Does face its significance of aspects of history. You did not pay attention. You paid attention to this, that she is losing weight. Does not elicit or explore enough detail. Now, I cannot say that you covered the symptoms of anorexia in depth. Does not demonstrate adequate skills and risk assessment. You did assess the risk. Does not pay sufficient attention to the patient's health view. If you assess the anorexia, the symptoms of the syndrome in this same way, by the way, you will not find it anywhere. When you assess any phenomenon, you want to know what the patient is thinking of, his feeling, physical symptoms, and his behavior. When you cover these points in depth, definitely point number 5 will be scored for you because you paid attention to the patient's health view. Does not identify appropriate psychological social information. You covered the social information, psychological information. Because you did not reach the point where you will give me the diagnosis, so this can be considered as poor management of the consultation. You're not very empathetic. You were asking questions about sensitive issue without showing empathy or taking permission, so you can be considered as formalic. And also you can be considered that you are not showing the appropriate attitude. Other than this, everything regarding your communication skills is okay. But for the first time with a difficult station, this is, by the way, anorexia nervosa is one of the most difficult stations. But you are very clever. Okay, practice it. Okay. Who would like to go next?
I'll go.
Dr. Who?
Sure.
Dr. Sophie or who?
Either one of us.
No, not you. Who is going to do the station? Right? Okay, just raise your hand or say.
I'll wait.
Doctors, doctor. Okay,
I will.
okay. So what is your station, though?
Social phobia.
Okay, social phobia. Okay, so I have 2 minutes.
How can I address you?
You can call me Robin. Ready?
Robin.
I'm ready whenever you're ready. Ready?
Yes.
Very clever. Okay. Okay, let's start. 1, 2, 3, go.
Hello, Mr. Robin. I'm Dr.
Hello.
Gajula, psychiatrist working in the clinic.
Hello.
Thank you for seeing me today.
Hello. Yes, yes.
And,
Well,
yeah,
it is an embarrassing situation, but this GP said to me I should discuss this with you.
I understand what you are going through, Mr. Robin. From the GP notes, even I understand that you are having your marriage coming soon, right? And
Yes, yes.
could you tell me more about that so that I can help you with this?
Well, actually, I'm happy with the marriage, but the issue that I will have this marriage ceremony and I will be the center of attention of everyone is making me very tense. You know, I've been avoiding these situations all of my life, and I'm really very worried about this to the extent that I might cancel the wedding.
That's really tough to hear that. So you're avoiding these type of situations all your life. Since when has this started in the first place?
Well, I can't. Maybe it started since after the secondary graduation, and in the graduation ceremony, I stumbled on the theater, and everyone, laughed at me. It was a very embarrassing situation. And since then, I decided to avoid this situation, and because I'm not the best one in this situation.
It
I
must
don't
be
do
really,
good.
really difficult. Okay.
Yeah.
So
it has been on so maybe for not less than 20 years now.
So has it been increasing of late? This
Well, no, just only whenever I'm among many people which I'm not happy, which I don't know. I don't feel that I'm happy with this situation. I just try to avoid as much as possible.
So you're trying to avoid. So, Mr. Robin, what would happen if you go through the situation? What runs through your mind?
Well, I'm going to do something stupid. Everyone will laugh at me. I'll just definitely, do something silly. Okay, this is the main thing which runs in my mind.
So, without staying feeling anxious at the time.
Yeah, yes, exactly.
So, along with that, have you noticed any changes in your body during that time?
Well, many times, I feel that my mouth is very dry, and I'm shaking in my voice, and my hands are shaking, sweating. So definitely, if I continue, I will be, the center of attention. Everyone will make fun of me.
That must be really difficult. Mr. Robin, how did you calm down during that situation?
Well, the only thing which helps me is just to flee out of this situation and to avoid it. This is my best way. And I've been always avoiding these situations. I prefer to be just far away from the center of attention whenever there is a social gathering.
So that must be really difficult to go through this all your life. So how has this affected about your work?
Well, as now I'm about 40 years old, and I'm still my wedding now. I've been very late in my emotional life. Also, I've declined many job opportunities. Everyone said that it was good, but you know, including being the center of attention, just giving lectures and you know how educate, just being in the center of attention of people. Just I avoided these situations and these jobs.
So what about your family? How do they react to this?
Well, they always say that I'm just someone who doesn't like to be among people, and it's not about liking. Just I feel that I feel tense among people. I don't do good among many people, particularly if there are many people whom I don't know.
So have you spoken this thing about this anxiety to your girlfriend?
Yeah, they know this about me, so they don't feel that whenever I'm there, they just don't bring someone whom I don't know, many people whom I don't know.
Mr. Robin, sometimes people with this problem can have some other problems as well. I would like to ask a few more questions. Is that all right?
Okay.
Apart from social gatherings, any other thing that you're worried about?
Like what?
Like worrying even for simple things?
Yeah, I'm I'm a person who gets easily worried, yes.
And any specific thing that you are afraid of?
What?
Anything that being alone or traveling?
No.
Okay. With all this going on, how has been your mood?
My mood is fine. I'm happy that I'm going to have
What about your sleep? Okay.
My sleep is good.
Any unpleasant dreams anytime?
No.
Okay. How about your energy levels?
Everything is fine.
Okay. Anytime, have you had any unpleasant thoughts repeatedly coming to your mind, but you are not able to control that?
No.
Okay. Sometimes to get out of your anxiety, have you tried any alcohol?
No.
No. Any
1
street
minute
drugs?
remaining. 1 minute remaining.
Any street drugs?
No.
Have you ever visited mental health doctor before?
Excuse me?
Have you ever visited mental health doctor before?
No, this is the first time to talk to
This is the first.
someone.
Okay. Any physical health problems I need to know of?
No.
Mr. Robin, from what we have discussed today, it seems that you are going through a condition called a social phobia. For that, we have options to help you with this. I would like to book another appointment to see what best works for you. Is that all right?
Yes, no problem.
Thank you, Mr. Robin.
They're very clever. How do you feel about what you did?
Yeah, I think I failed to cover a few things like family history and risk also.
Well, first of all, I did not feel that you're very empathetic when I said to you that I'm going to have my marriage. So just say congratulations. It's definitely a very good experience and so on. Very clever from you that you ask about alcohol because
Sorry, I didn't get you. Sorry, I didn't get you.
you did not show empathy. I did not show in the beginning that you have a lot of empathy. Empathy is very important once you hear me complaining. Okay, so after the complaint, they immediately show empathy. When I said to you that I'm about to have my marriage ceremony, just show congratulations, which you did not do. And good that you talked about alcohol, because it's not uncommon for those who have social phobia to soothe themselves by alcohol. Let's see the feedback of our colleagues. Okay, you gave this information to her, so Okay, so nobody gave you any feedback. Give her some feedback, please. Let's see, it's social. This is one of the straightforward stations. We should be organized. I don't think that this is a difficult station. The pulse rate in this station is high. So in the beginning, just do your introduction and take the complaint. Always start by taking the complaint. You want to know the current circumstances and what exactly is worrying him. And you start asking about the onset, the course, and what increase or decrease. And before that, anything happened, how was he doing? You will know that he started early on, so there's nothing exactly about before the onset because it has been on for all of his life. So, as I always say, if you want to know any psychological phenomenon, ask him about how does he feel during this situation, what are his thoughts, physical symptoms and behavior, and ask him if he has any plausible explanation for what he is experiencing, okay? So this question is important because as you can see in the mark sheet, there is a part of the, there is a point for those who are keen to know the patient's health view. So ask about his feeling, thinking, physical symptoms and behavior. This will help you exactly to know the experience of the patient. Now the comorbidities, always use a signposting sentence. Don't jump from the symptoms of the social phobia situation to the comorbidity without showing that you are going to this area. This is called signposting. So I would like to check if there are other associated problems and check the psychological, physical, and social problems which he has in his mind. In this aspect, it is very important to ask about the associated, if he has any thyroid problems, like any change in the way he feels to hot or cold weather. Always ask this about the thyroid problem with the anxiety disorder. Not uncommon to have this association between the thyroid problems and the anxiety disorder. Very good. The impact, coping and risk, very important. The impact of this on his life and how is he coping about with it, particularly with alcohol. And just, it would be better if he had any thoughts of self-harm, just the routine questions. Past history and family history you did, and then you delivered the diagnosis. All in all, it was a very good performance. A very, very good performance. Always, doctors, whenever you are covering any subject of any stations, refresh your memory with educational images. This will help you to be more confident in the station because you know what you are talking about. It will be reflected in your performance, your attitude, and your tone of voice, okay? I will not go through the mark sheet, doctors, for time issue, but very clever. For me, this is a clear pass. Very clever.
Thank you.
Thank you so much, mashallah. Very clever. Okay, who would like to go next?
Can I go next, please?
Who, Dr. Sophie?
Yeah, hi.
Okay, so what is your station, doctor?
Mine was hypochondriasis.
Okay, you have 2 minutes. Okay, ready?
Mhm.
Okay, so let's say that my name is Mr. White. Okay, so and be ready that in this in this station, you will have a challenging patient. He is not happy to see a psychiatrist. Okay, he believes that he has a brain tumor. Why am I talking to psychiatrist? He will be a bit defensive. So then don't be perplexed. Don't be afraid of it. Okay, 1, 2, 3, go.
Hi there, good afternoon. Is it Mr. White?
Yes, yes.
Hi, my name's Dr. Sophie Nocton, and I'm one of the mental health doctors working in the clinic here. I've been asked to see you by the neurologist, and I understand you might have some questions about that, so perhaps we could start with...
Well, are you sure that there's no mistake here? Because I think that I'm not crazy. I don't think that I need to talk to a psychiatrist. I requested an MRI with a dye from the neurologist. So instead of referring me to a radiologist, now I'm talking to a psychiatrist. I don't know what's going on.
No, I understand this wasn't quite what you were expecting, Mr. White. The reason that the neurologist asked our team to get involved is actually because it sounds like they've done quite a few investigations and they haven't been able to find any physical cause for your symptoms. And actually sometimes there can be quite an interplay between the mind and the body, especially with headaches and things, which has been a problem for you. So the neurologist was asking for us to maybe explore what might be going on and see how we could help. Would that be okay?
Okay, no problem.
Okay, thank you. So it's my understanding, Mr. White, that you've had these headaches for some time, is that right?
Yes, it started about 6 months ago.
Okay, that's quite a long time, isn't it, to have these headaches?
Yeah.
Was there anything particular that was going on at the time when the headache started?
So nothing in particular, just I started to have this headache. It's just very throbbing. You know, this type of headache, which is associated with brain tumors. I know about this issue, so this is what's going on with me.
I see. So you're quite concerned you have a brain tumor, is that right?
Yeah.
I see. Okay. So I'd just like to ask you some questions about your headaches first before we go on to address
Okay.
your... That's okay. So you said it's a throbbing headache. Whereabouts in your head do you get the pain?
What again?
You said to me it's a throbbing headache, Mr. White. Whereabouts
No,
in your head?
it's not a type of throbbing, just dull, you know, just type of headache which you cannot decide its type. It's very annoying, very aching, and it's just consumed my mind, and I can't do anything because of it.
I see. Okay. Okay. Does the headache ever wake you up from sleep at all?
No.
No. Okay. All right. Now you mentioned that you're concerned that you had a brain tumor. When these results come back from the neurologist and they've done various tests and things and explain the results to you that you don't have a brain tumor, how does that make you feel?
Well, definitely it makes me very happy, but you know, the pain, the headache comes back. So definitely there is a mistake. My explanation is that definitely the brain tumor is very small. So it needs again and again doing MRI to make sure to pick it up in order to make sure that it will not go bigger. Okay.
I see. Do you ever feel reassured that any of the scans have been normal at all?
Yes, I told you, whenever it is normal, I feel reassured, but this doesn't last long because in the very first day or maybe second day, I start to have the same headache. So it doesn't make sense to be reassured by the investigations while I'm still having the headache.
I see. Okay. And over looking at the last 6 months when these headaches started, have they stayed the same over that time, or have you been experiencing them more frequently?
No, it's increasing in frequency now. You know, I'm taking more and more sick leaves. I spent a lot of money doing investigations. Now it's increasing.
Okay, so I can see it sounds like it's really impacting you all across various aspects of your life. So tell me, how's it affecting you at work?
Yeah, I'm taking too much sick leaves, and I've been warned about this because I never wrote for them any justification yet. But I know that I'm having this brain tumor.
Okay, and you said financially because you've had various investigations. Is it affecting any of your relationships?
Well, my wife is so stressed because she feels that I'm paying too much time just searching for the brain tumor and talking about it and doing investigations and taking sick leaves and I understand what she's where she comes from, but you put yourself in my place.
I can see it's very troubling for you, and when you're continuing to have this pain, that's absolutely, I can see that it's incredibly distressing for you. You mentioned that you've done quite a lot of online research to look into what might be going on, and you sound quite certain that it's a brain tumor.
Yeah, I'm sure that it is a brain tumor. Just there's a mistake in your investigations.
I see. Do you know anyone who suffered from a brain tumor in the past, or?
Well, my uncle died about 8 months ago because of this brain tumor, and I was, I'm the one who was accompanying him, and I know quite well the symptoms of the brain tumor and the type of headaches which was getting. So I'm having the same type of headaches.
I'm very sorry to hear about your uncle, and I do pass on my condolences, Mr. White. I just want to move on to some other questions, if I may. Have you ever seen a psychiatrist in the past at all?
No, this is the first time to talk to a psychiatrist.
Anyone in your family had any mental health problems in the past?
No, the first time. 1 minute remaining.
You. And I know we've talked about your physical health there in terms of the headaches. Do you have any physical health problems at all? You're in any medication?
No.
We've talked quite a lot about the impact. I'm just wondering how you're managing to cope with this. Do you ever drink any?
Well, the only thing which helps me is just to stay in a dark room for about 2 hours and sleep. This will help me to make the headache goes away, and I don't know what to do else. I stopped taking painkillers because I know that it's not good for my health. I used to take a lot.
That is a good step. Sometimes when people are having lots of pain, they can feel that it's too much to bear and have thoughts of taking matters into their own hands. And I'm just wondering if that's been a problem for you at all.
No.
Pleased to hear that. Thank you.
Okay.
So, Mr. White, I think what may be going on is that you might have something that we'd call a health anxiety disorder or a hypochondriasis. Have you ever heard of this before?
Very good. Very clever, by the way. It was a performance. It was good. Definitely your language and communications are good. So, but give me an idea, how do you feel about what you did? And please give her some, you have a lot of fans here. Well done, Sophie, very good. A lot of fans.
I think I developed an anxiety disorder during that.
Have you ever been to the Costco before? Well, this is very clever. Very, very clever, mashallah. No comment except that in order just to come up with a diagnosis that it is a psychological type of headache, you want just to dig more about the symptoms type of the headache itself. So you want to know the nature. Give me a nature about where exactly the part of headache, because there are different types of headaches and types of headache, migraines. So it's not when we say headache, you want to know exactly where it's the headache. Okay, the location, does it progress? Is it associated with nausea and vomiting? Usually the severe types of headache are associated with nausea and vomiting. The psychological type of headache is not associated with nausea and vomiting. Does it affect the vision? Okay, so if there is any associated neurological phenomenon. Okay, sleep, the pain of headache, very good question which you have. And you want to know exactly how long does it last? You ask about how is he doing before the investigations and his explanation. So you cover these 2 points, but there are other points. It would be better to ask about just to make sure that you give the impression to the examiner that you know how to ask about a pain or a headache to come up with a diagnosis that it is a psychological headache. Okay. Headache is a very common psychological problem, so just have a rapid idea about what are the types of headaches. We know that it's only headache. No, it's more deeper than this. very common to be associated with psychological problems, and you should know how to ask about it. I'll not go through the mark sheet again, very clever. My only comment is just to know how to ask about these small details about that. Other than this, it was more than perfect. MashaAllah. Thank you. Very clever, Dr. Sophie. MashaAllah. Thank you.
There you go. Had the benefit of listening to all the other teaching. So thank you.
Yes, MashaAllah. Thank you, Dr. Sophie. So who would like to go next?
Myself.
Dr. Zaid?
Yeah, Dr. Zaiso.
So what is your station, Dr. Zaid?
Sir, it is bulimia.
Okay. I will just put okay, so this is the station. Bulimia. Again, eating disorder. Eating disorders generally are difficult stations, and they usually come because they're very challenging. Okay.
Yeah, sir. Shall we move on?
Yeah, sure. You can start. Let's say that my name is Mr. Brown. Oh, Mrs. Brown. Mrs. Brown. Okay, let's. 1, 2, 3, go.
Hello, Mrs. Brown.
Hello.
I am Dr. Ahmed, one of the doctors from the mental health team.
Hello.
I'm here to discuss, as the doctor is treating you has been asked to talk to you regarding the episodes of recurrent admissions, and they are quite concerned about that you have recurrent admissions. And they also brought into the attention that there is some concern about omitting insulin, and there is some sensitive discussion about during this discussion. So is it all right if we move
Okay, no
from
problem.
here?
No problem.
Okay. So, Mrs. Brown, can you please tell me what exactly is the reason that the doctor has suggested you that you had been diagnosed with type 1 diabetes and insulin is the line of treatment, but still you are omitting?
Well, I have diabetes and I should take insulin, but I omit. I don't take it because it makes me gain weight, and I lost and I fainted because of increased sugar level, and I was admitted twice. And they said that I must talk with a psychiatrist about this issue.
Yeah, that's absolutely all right. And this is really, really difficult for you that you are getting admitted over here. So, what do you think? That the possibility of weight gain is associated with insulin, but it is helping you in managing your insulin, but still you are not able to take it. So, what exactly is stopping you of? No.
I feel that taking insulin does not help me to lose weight.
Okay.
So I stopped taking insulin. But you know,
Okay, okay.
everything is fine when I stopped it. But the problem that sometimes I do wrong things while I'm eating, and this makes me have this high insulin level.
Okay. And what exactly is it you do that results in high insulin level?
You know, I control my diet in a very good way, and I
Mm-hmm.
start to lose weight. But
Mm-hmm.
whenever I'm stressed, you know, sometimes I eat too much, and without
Mm-hmm.
insulin, this spikes the blood sugar level, and I go through bad consequences, and I go to the hospital.
Mm-hmm. That's really difficult for you. You told me that there are episodes where you take a lot of meals over there. So did you able to control that?
Well, during the event, I cannot control, but what happens after
Mm-hmm.
that, I try to get rid of the consequences. So I try to vomit or get rid of the food or exercise
Mm-hmm.
excessively.
Mm-hmm. Okay, okay. You exercise excessively. And do you do, like you said, you vomit? Do you use any other way of like getting rid of what you had?
Excuse me?
What I want to ask, that you vomit so that you won't gain weight. There is any other way you try in a way ki you
No,
should
just
not get
mainly I
weight?
just vomit the food which I ate and then just exercise as much as possible.
Exercising. And how do you feel about it after that?
Well, I feel, you know, I feel that what I did was wrong, and I
Mm-hmm.
stopped, and I feel bad, but I don't know. But at this time, my insulin, my blood sugar level spikes.
Mm-hmm. Okay. Yeah. And I understand the weight is a very important aspect to be seen. What do you think? What is currently is your weight?
62.
And what do you think? What is the expected weight at for you?
Well, if it is above 57, 56, I think it will be very good.
Okay. And what is your height?
165.
Okay. So anything like the doctor has said about this, the relation, any specific uh, value for this height and weight? Is it all right for you, or there is something it requires
Nobody,
attention?
nobody commented about it. Nobody commented.
Oh, definitely. I think we'll be discussing it on the later. And okay. And do you think the weight is so important for your body image?
Well, I feel that I don't look good with this weight. That's why
Mm-hmm.
I'm trying to lose weight.
Mm-hmm. Okay, okay, okay. And is like how long since you are trying to do like this?
What has been going on for several years, doctor? See,
It is going for
yeah,
several years. And like,
yeah.
may I know how many episode in the has happened during these several years?
Maybe 12 times, maybe during
Oh,
the past 10
that's really
years.
difficult for you.
Yeah, yeah.
Okay. And did you ever get hospitalized for that?
Yeah, because of the high blood sugar level.
Oh, yeah, yeah, that is there. Any other reason for
No? What?
hospitalization?
No, no, no.
Okay, okay. And you told me there are several episodes. Are there any specific factor whenever like you get more focused about your weight?
1 minute remaining.
Yeah.
Again, I didn't
Any
understand the
specific
question.
any specific factor when these episodes happen?
What do you mean? I don't know. Any specific factors?
I mean that you start focusing more on your weight. You said it happens 10 times in
Reasons?
years.
You mean any
Yeah,
particular
reason.
reasons?
Yeah, yeah.
Well, whenever I'm stressed, I think I broke with my boyfriend about 6 months ago, and this made me feel that
Mhm.
if I looked better, definitely I wouldn't have been through this experience.
I understand it has impacted in your physical health. How it has impacted in your personal life as well as in your work life, in your studies, basically.
It didn't affect my study too much, except the periods when I'm in the hospital.
Oh, that's difficult. And with this difficult scenario, did you ever try that you don't want to be anymore?
No, no, no.
And any family history, someone in the family has this sort of illness
No,
associated with eating? Okay,
no,
okay.
no.
Thank you, Mrs. Brown, for talking to me. And I think that along with the diabetes, you have disturbances in terms of your eating pattern, and possibly we will evaluate more. Possibly it looks like to be a illness suggestive of a bulimia, where you are having excess eating and then vomiting episodes. We will schedule another session for that. Moving on.
Fine,
Thank you
fine.
for talking
How
to
do you
me.
feel about what you did? How do you feel about what you did?
I think I gave a lot of time of exploring the history. I should have been shortened it so that I can give more focus on impact, coping, and risk.
Yeah. Okay. How do you give him some feedback? Okay, look. So your introduction, please go in directly into the task, please. So let's see what is the task here. What is the task? Let's see the task. And this should
Task is
be your,
about
yeah.
history of eating disorder and positive and negative prognostic factors.
Exactly, exactly. So you must put this task on your introduction, because as I said, introduction simply addressing the greeting the patient, introducing yourself and talking with the patient and explaining the reason of your talking with him. So you want to know exactly her eating patterns. So weight and eating habits can be sensitive issues. However, the medical team feels that the uncontrolled blood sugar level can be cause of them. Therefore, I would like to discuss this sensitive issue. Are you okay with that? Okay. This is how you start the say. I felt that you are just roaming around this issue. I don't know why. Please, the introduction will help you to save time. So your introduction needs to be improved. Then your second step is to take the complaint. As we said, the complaint is the current situation, onset, course, and duration, and how the patient was doing before the onset. So the current situation, you want to, it has been mentioned in the note that you have been omitting the insulin. So this is your current situation. Can you tell me more about that? She will explain to you that she is omitting insulin because she wants to control her weight. So what is your current weight? How much weight did you lose? What is your ideal weight? So this is your current situation. I want to know the onset. Since when have you started feeling uncomfortable because of your weight? Anything happened at this time? So 10 years ago, she started to feel that her weight is not good, and maybe she has been bullied and so on. So this is the onset and cause. Do you always feel like this towards your body weight? Anything increase this feeling whenever she's stressed or feeling low in her confidence? This feeling is increased, and so on. And before the onset, you want to know, before the onset, how was she doing? She has been bullied because of her weight and so on. So this is how you gather the complaint. This is how you start. The current situation, the onset course, and the duration, and before the onset. Okay? Okay, so far? Now we know that there is an eating problem here, and there is a syndrome which you want to ask about. And we always say, if you want to know any psychological phenomenon, you want to know exactly what are the thoughts of the patient regarding this phenomenon, how does he feel, the behavior, and the physical symptoms. So the thinking, so what is your ideal weight? So what are the thoughts related to this issue? What is your ideal weight? How many kilograms you should lose? Are you preoccupied by calories in what you eat most of the time? So these are the thoughts of those who have eating disorder. They have disturbed body image. They are also preoccupied by eating and calories. Feeling. How do you feel whenever you eat too much? Does your weight make you less confident? Okay, pay attention to this question. Does your weight make you less confident? Okay. And then the most important thing is the behavior. So what do you do to lose weight? Is it okay to take me through your eating habits? Have you ever ate a big amount? And ask her so the details of the behavior of the bulimic patients. Okay. And then physical, apart from the high blood sugar level, if she has been through any other physical problems, like dental or bowel problems, which are very common among those who have the eating disorders. Now, the comorbidity, she is already assessed physically and only has uncontrolled diabetes mellitus, so no need to ask in details about the comorbid physical disorders. And while you are checking the comorbidity, check the etiological factors. Okay, so the comorbidity is always the area in which you check for the etiological factors. So thank you. And signpost, before you jump into the comorbidity, this is the signpost sentence. Thank you for being open with this sensitive issue. I would like to know if there are any other concerns. Ask about the associated psychological problems. Okay. Very important here to ask about the impulsivity. It is very common among those who have bulimia, the impulsivity. And the symptoms of the borderline, the impulsivity and the disturbed childhood. And very also important to ask about the social aspects, supportive family, stressors, anyone who's close to you, and so on. And then the impact, coping, and risk. Any police charges, well, associated with kleptomania is associated with it. So one might ask, so what is the relation between police charges and the bulimia? Kleptomania is common to be happening with bulimia. And then past history and family history, not uncommon to have another patient in the family with an eating disorder, and finally delivering the diagnosis. You must say to her that she has bulimia nervosa, it is an eating disorder. I will give you leaflets and I'm looking forward to see you again. I will not go through the mark sheet, but definitely when you practice this station again with this feedback, it will be a better performance, okay? And always, whenever you are having any subject to revise, always have a rapid refreshment of your memory with the information related to this topic. This will help you to be more confident, and this is very important to be confident in the task. It's very important. This will help you to pass, okay? Thank you, doctors. I hope that you found it helpful. Really, it was a privilege and a pleasure to be with you. I think we have finished. Please revise the stations and always have a look at on my channel regarding the explanation of history taking. This will help you to understand the plan and how this particular station notes are formulated. Thank you so much, doctors. Good luck. Hope to see all your names in your pass list.